Now at 5 o'clock, deciding which way to vote on question 1, the bill that would limit the number of patients that can be assigned to a nurse. Ads on both sides of the ballot question have been flooding the airwaves.
And today, the state weighed in with a new study on what would happen if question 1 passes. Here's WBZ political analyst John Keller.
At the end of the day, if this ballot measure passes, patients would be put at risk.
You've seen the dueling ads, the no camp decrying costly overregulation of hospitals.
Patient limits mean more time with your nurse.
The yes side promising better care.
Independent scientific studies agree.
Dozens of studies.
But today, the state's Healthcare Policy Commission released its own study, siding with the industry's forecast of massive new costs.
I'm not enamored by what I saw in there.
The nurses' union is charging the commission with over-reliance on industry data and accusing them of failing to address a, quote, growing patient safety crisis.
If I have 4 patients and you put on your call button, I can get to you. If I have 8, you wait. What happens when you wait? Sometimes something bad happens.
I'm not so sure that the nurses' union considered Franciscan children when they put this on the ballot.
But to this small hospital CEO, question 1 is a disaster in the making.
What we would have to do in order to comply with the regulation is to cut back about 1/3 of our beds, which would mean for us a $2.5 million revenue loss on our bottom line, and we're a break-even charitable organization.
The one thing that this does different is it really, for the first time, gives a vote to people and puts them in control of health care.
And both sides, as I'm sure you've noticed, Lisa, have been featuring nurses in their ads, and I think that's really added to voter confusion over what this is all about. It's complicated.
It is really complicated. Is there any precedent for this? I know California passed a similar measure. Have we learned anything from what happened there?
Well, the Health Policy Commission did take a look at the existing studies about California, and they found that there was a significant increase in nurse staffing. Obviously, you're hiring more nurses. Only a moderate increase in wages for nurses, which was interesting. Overall, not much impact on patient outcomes, which surprised me. And they haven't done a study of what it did over time to costs. That left the Massachusetts Commission reliant on local data here, and that's what's upsetting the union.
Right, and that's really the big question.
It's a major question. They're talking about $900 million. That's going to hurt some of the smaller hospitals especially.
Wow, John, thank you.